Good morning, sir. I am Mark and Together, and I will be performing the demonstration on the neurologic system of the patient. So, first that we're going to do is gather all the equipment such as the examination gloves, pencil, cotton applicators, newsprint to read, ophthalmoscope, paper clip, Snellen chart, sterile gloves, and turning fork, tape measure, ruler, also hot and cold water, and substance that the patient can taste and smell. So it is important for us to gather all the equipments para accessible siya anytime na kailangan natin siya and makasave tayo ng time and effort. So after gathering all the equipments that we will need later, next is we need to explain the procedure to the client. It is important to explain the procedure to the client para alam niya na yung gagawin niya and ma-aware siya sa mga procedures na gagawin natin. So, sir, today we will be assessing your neurologic system, especially your cranial nerves functions, and also, first we need to introduce ourselves to the patient. So, sir, I am Mark Edsel Together, and I will be your student nurse for today. So, sir, would it be okay if we will have some test on you later? Sir, may I ask what is your name, please?
Christian,
How old are you, sir?
15.
It is important for us to identify the patient using two identifiers to make sure that we are doing the right procedure to the right person. So next is to ask the client to wear the examination gown to provide privacy to the patient, since we will only be needing some parts of the body, so it will provide privacy to the patient. For the mental status of the patient, kanina while we're assessing the subjective data, I can assess that the level of consciousness of the patient is well and fine. The patient has able to respond to all my questions and is able to answer me directly and with no hesitation and good. And next is we need to observe the appearance and behavior of the patient. So as we observe the patient looks well and fine, and also the appearance of the patient. Next we need to observe is the mood of the patient, feelings and expression. As we can see, there is no violent reaction or facial expression on the patient. The patient was able to cooperate properly and wholeheartedly. Next is the observe the thought process and perception. So as we interview him kanina sa pagkuha ng subjective data, makikita natin na yung perception ng patient is openly and tumatanggap siya ng mga teachings, so that is a good part for the patient. So next is the observed cognitive abilities. The patient was able to answer all my questions kanina while we're assessing the subjective data, so it is a sign that the cognitive ability of the patient is also well and fine. After the assessment on the mental status of the patient, next is we need to assess the cranial nerves of the patient, kung nagpa-function ba ito na mabuti. So first is we need to test the cranial nerve number 1, which is the olfactory. So to test the olfactory of the patient, we can ask the patient to clean his nostrils and remove excess mucus secretions on the nasal part of the patient. So na-instruct ko na kasi si patient na linisin yung ilong niya and also tanggalin yung mga obstructions sa nostrils. So, kailangan natin gawin is to get any substance that has smell and let the patient identify. For this test, we will ask the patient to identify what is this substance. So, sir, can you... Ano po ito, sir?
Vanilla.
So that's right, it is a vanilla essence. So next is so sir, ano po yan?
Alcohol.
So it tries alcohol. So as we can see, the patient was able to identify the two substances that we instruct him to identify, which is the vanilla essence and the alcohol. It's also a sign that the nostrils of the patient and the cranial nerve number 1 or the olfactory of the patient is functioning very well. So after assessing the cranial nerve number 1, let's proceed to test the cranial number 2, which is the optics. So first is we need to perform the Snellen chart test. So ask the patient to move 20 feet apart from the chart. In performing this test or this Snellen chart test, ask the patient to cover his one eye using the opaque card and instruct the patient, cover lang po sir, and let the patient read the letters that you are pointing, so sir.
E, F, T, E, O, Z, L, E, E, D, B, E, C, F, D, E, D, F, C, Z, E, F, E, L, O, P, Z, D, Z, E, F, A, R, E, C, E.
So as we can see, the patient has able to read the letters in the Snellen chart in the 20/20 vision. So, as a result, the left eye of the patient has a 20/20 vision acuity test. So, next is on the right side. So, right eye. So, ask the patient to cover the left and let the patient read again.
E, F, T, E, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, E, F, E, L, O, P, Z, D, D, F, F, T, O, E, E, C.
So, as we can see, the right eye of the patient also has a 20/20 vision vision 20/20 vision. So it is a normal for his age. So thank you sir, and balik ko na. So after performing the Snellen chart test, next is we need to instruct the patient to perform the near vision acuity test. So instruct the patient to read the sentences within 12 inch from his eyes. So sir, pwede niyo pong basahin yung sentences po.
Inspect the auricular tragus and lobule for size and shape, position, lesion, discoloration, and discharge.
So, as we can see, the patient has able to read the sentences 12 inches apart from his eyes, which is a normal findings. So, after assessing the cranial number 2 of the patient, which is the optic, next is we need to assess or test the cranial number 3 or the oculomotor. Also, isasabay na din natin yung test for cranial number 4 and cranial number 6, which is the trochlear and the abducens. So, first test that we're going to do is the visual field for gross peripheral test or vision. So, first, instruct the patient to wag igagalaw yung muka. Only the eyes will follow the finger. So, Sir, sundan niyo lang po ito and sundan niyo lang po kung hanggang saan niyo po makikita. So, first is for the inferior. Sir, nakikita niyo po? Sir, nakikita niyo po? Sir, huwag niyo pong galawin yung mukha niyo po. Sir, nakikita niyo po? 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 Huwag niyo pong sundan, sir. Ayan lang po. Steady lang po kayo. Tingin lang po kayo din, sir. Nakikita niyo po? So, for the inferior, sir, nakikita niyo po? Sir, steady niyo lang po yung tingin niyo po doon. Huwag niyo pong, nakikita niyo po? Huwag niyo pong sundan ng mata niyo. Nakikita niyo po? Nakikita niyo po? Nakikita niyo po? Nakikita niyo po? So, for the temporal, sir, nakikita niyo po? Sir, nakikita niyo po? Sir, nakikita niyo po? Nakikita niyo po? Sir, nakikita niyo po? Sir, nakikita niyo po? Can you see it, sir? Nakikita niyo po? Nakikita niyo po? Nakikita niyo po? Nakikita niyo po? So, for the nasal, sir, nakikita niyo po? 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 Nakikita niyo po?
Uy,
As we can see, the patient was able to follow or able to see the movement of the fingers without moving his gaze and normally, so it is normal. So for the next test we will be performing the corneal light reflex to the patient. So in performing this test, we need to light the pen light or in the sides of the eye of the patient, which is 12 inches away. So, observe natin if magpo-constrict yung iris ng patient. So, as we observe, as we like the eye of the patient, the pupil constrict and it is a normal. Next is we need to perform the cover test to the patient. So, tatakpan lang natin yung mata niya and observe natin kung may abnormal movement or involuntary movement. So as we can see, there is no involuntary movement on the eye of the patient on both sides, which is a normal findings also. After performing all the tests for test cranial number 3, 4, and 6, now let's proceed to the test for cranial nerve number 5, which is the trigeminal. To test for the cranial number 5, we need to palpate the temporal and the masseter muscle of the patient. And as the patient, for the temporal muscle, as the patient palpate and as the patient to clenches it. So as we can see, there is a construction when we are palpating the temporal muscle of the patient. So next is for the masseter. Sir, pinch po or parang gigil? Oh, paano yung gigil? Grabe na. So as we can see, the masseter also contract, which is a signs that the cranial number 5 of the patient, which is the trigeminal, is functioning well. To further assess the cranial number 5 of the patient, next test is we need to perform the sensory function test, which is maglalagay tayo or uutusan natin si patient kung may nararamdaman ba siyang any sensation while we are taking the paper clip on his face. So, as the patient, kung may nararamdaman siyang sharp or dull.
Meron po. Meron. Meron po. Meron. Meron.
So, as we can see, the patient is able to identify the sharp sensation all over his face when we are poking this paper clip. The next test that we will performing will be the corneal reflex, which is gagamit tayo ng clean cotton, which ilalagay natin sa cornea ng patient and ask the patient to see the opposite side. So sir, tingin ka po. Open your eyes po. Tingin ka po. Tingin ka po. Open lang po ng nalang. So as we can see, the eye of the patient blinks bilaterally. Also repeat on the other side. Sir, tingin ka po doon. Open ito ng malaki. So, as you can see also, nag-blink din yung eye ng patient bilaterally, which is normal signs. So, after assessing for the cranial nerve number 5, which is trigeminal, next is we need to assess or test the cranial nerve number 7, which is the facial. So, for this test, we need to ask the patient to... Sir, mag-smile ka nga po. Hindi, paano smile? Good boy. The patient has able to smile and after assessing, asking the patient to smile, now ask the patient to front. Sir, front nga po. Front. Oh, paano galit? Galit. Oh, galit. Oh, galit guys. And next is ask the patient to wrinkle his forehead. So ayan, as you can see, there is wrinkles the face of the patient. And next is we need to show off his teeth. Sir, smile. Show yung smile. So next is ask the patient to pop out his cheeks. So, sir, palabahin niyo po yung cheeks niyo po. Sige po. And next is ask the patient to purse his lips. Sir, nguso nga po. Nguso po. Sige po. Sige pa po. Don't laugh. Don't laugh po. First po. Okay. Sige pa po. So, the patient is able to purse his lips also. And next is for the closed eyes po. Sir, ipikit mo nga po yung mata nyo. Open. Close, open, close, open. The patient is able to respond to the direction which is to close his eyes. And when closing his eyes, napipikit niya po ng mabuti and no abnormalities on closing the eyes of the patient. To further assess the cranial nerve number 7, which is the facial, we need to get a cotton applicator, moist with clean water and dip in salt. And ask the patient to taste. Sir, ano po?
Alat.
Ano po yan?
Asin.
Ano? Super, sir. Next is using the different side of the applicator. Ano pong laso, sir?
Matamis.
Well, sure? Hindi niyo po dinadaya?
Tamis.
It is sugar. So, as we can see, the patient was able to identify the taste of the two substances, which is the salt and sugar. After finishing the test for cranial nerve number 7 or the facial, next is we need to proceed to test the cranial nerve number 8, which is the acoustic. So, or the vestibulocochlear cranial nerve. So, first is we need to perform the Weber's test. So, in Weber's test, we need to have a tuning fork. Since we are on the pre-recorded setup or in the home, tuning fork is not available. So, we will use the nursing as an art and gagamit tayo ng gunting as substitute for the tuning fork. So, first is we need to strike the substitute of tuning fork in our hands and put on the top of the head of the patient and ask the patient to observe kung narinig niya ba on both ears yung sounds or vibration. So, sir, may narinig ka po? Wala po, sinungaling ka. So, it is normal na wala siyang marinig dahil hindi po ito tuning fork. Pero that's how we perform the Weber's test. So, next, and normally dapat marinig niya yung sounds on both ears. So, next is we need to perform the Ryan's test, which is dapat mas matagal niyang marinig yung sound sa air conduction than sa mastoid. So, mastoid process. So, next, strike and so, narinig ko kayo?
Wala.
Meron, sabihin nyo. So, sabihin nyo kung meron kasi kunyari lang po. May narinig po?
Meron daw.
Meron pa?
Wala.
Sabihin nyo pa wala na.
Wala.
So, ililipat natin dito pag wala na. Sir, may naririnig ka po?
Wala.
May naririnig ka dapat. Meron ka pong naririnig?
Meron.
Meron po siya naririnig which is normal. Sinungaling ka talaga siya. Next is we need to assess or test the cranial nerve number 9, which is the glossopharyngeal cranial nerve. So, in this test, using a tongue depressor, i-ask natin si patient na ibuka yung bibig ng malaki and say, and observe for the uvula and soft palate of the patient. So, as a substitute for tongue depressor, we will use a stem of the spoon. Sir, let me say, Saba po? So, as you can see, as the patient say while pressing the tongue depressor, the uvula and soft palate rises bilaterally and symmetrically with phonation, so which is a normal. Next is we need to test for gag reflex. So, i-ano lang natin yung tongue depressor sa posterior pharynx of the patient. Apo. So, it is normal for the patient to have gag reflex when testing the gag reflex. Next is we need to ask the patient or test the patient's ability to swallow by asking the patient to drink and pagkainom na, pagsalitain po natin siya ng words. So, sir, sabihin mo yung pangalan mo pagkatapos mo namin. So as we can see, there are no hoarseness on the voice of the patient after swallowing the water. So after performing for the test for cranial number 9 and 10, which is the glossopharyngeal and the vagus, next is we need to perform the test for cranial nerve number 11, which is the spinal accessory. For this test, isa-shrug lang natin yung shoulder ng patient and i-ask natin siya na pigilan. Sir, labanan niyo po yung itaas. Try niyo. Taas, ayan. So as we can see, the patient was able to construct or labanan yung force sa isa pa po. Ayan. So makikita natin may force and kaya niyang labanan yung force na pag-press natin sa shoulders niya. And next is we need to assess the sternocleidomastoid muscle, which is i-ask natin si patient na lumingon while we are forcing here the muscles. So, try nyo pong tumingin po. So, the patient has able to move or break the force by nakakalingon po siya while may force na sa gilid niya, which is normal signs po for the test cranial number 11. Next is we need, after performing for the test cranial number 11, next is we need to perform the test cranial nerve for cranial nerve number 12, which is the hypoglossal, which is instruct natin si patient na ilabas yung tongue niya and instruct the patient na i-move up, down, side, and forward. So, ilabas yung nila, up po, down, sides po. So as you can see, the patient is able to move his tongue properly with no pain or any obstruction. Next is we need to assess for the force of the tongue of the patient by asking the patient to put our hands with the buccal mucosa, and dapat may maramdaman tayong force na tinutulak ng tongue niya yung hands natin. So, sir, itulak mo po yung hands. As we can see, there is a force pushing my hands outward, so it is normal. So that's all tests are for the cranial nerve assessment. Next, we need to assess is for the motor and cerebral system, which is first is we need to test conditions and movement of muscles. So as we can see, the muscles of the patient are well and fine as we assessed earlier. And next is test for the balance of the patient. So first, ask the patient to walk. Sir, lakad po po. Sir, sige po, ikot ka na lang. So as we can see, the gait of the patient is steady and hindi po siya natutumba-tumba. And next is we need to perform the Romberg test. So in Romberg test, ask the patient to, sir, tayo ka po. And isara niyo po yung mata niyo po. Ayan. So, for 20 seconds, i-observe natin yung movement ng patient. So, as we can see, the patient is able to maintain his balance while closing his eyes, and the equilibrium of the patient is functioning, and that's why hindi po siya natutumba. So thank you, sir. Next is we need to ask again, patient to, sir, tayo ka po. And tayo, taas niyo po yung isang paa niyo po, sir. And talon ka po, sir, using your one feet po. So, sa kabila naman po. So as you can see, the patient is able to balance also, which is normal. Next is we need to assess the coordination of the patient or test the coordination. So as natin si patient na i-wide mong arms, and sir, i-close mo po yung mata nyo, and using your left index, sir, i-dudulong nyo po. And ipunta nyo po sa ilaw nyo, touch nyo po yung nose nyo po, o yung ilaw. Sa kabila naman po. Sa kabila po. Isa pa po. Sa kabila. Isa pa po. Sa kabila. So, as the patient to repeat the process 3 times, and as we can see, there are little hesitation, and that is normal. And the patient also was able to touch the nose properly. Next, we need to assess the rapid alternating movement of the patient by asking the patient to touch his finger using his thumb, like this, sir. Sige po. And ask the patient to do it faster. Faster pa po, ayan. Isa pa po. So, sa kabila naman po, sir. Faster po. So, as we can see, the patient is able to perform the test properly, which is normal. Next, we need to assess the rapid alternating movement in the palms. So, ganyan nyo lang po. Mabilis po. Sige po. Thank you po, sir. So, the patient was able to move his hands properly also and rapidly. So, after performing for the motor and cerebral system assessment, next is we need to perform the sensory system assessment. So, first is we need to take the light touch, feeling, and temperature sensation. For the light touch sensation, using the wrist of the button, ask the patient to close his eyes, and it has so you guys know and the mata. Tapos, tap the button on the distal surface of the patient, dorsal. So, nararamdaman po. So, as we can see, the patient is able to identify the light touch sensation. So, next is for the, after assessing the light sensation, next is we need to assess for the dull stimuli. So, bigyan ko pa nga tayo, sir. So, nararamdaman po. So, as you observe, nararamdaman din ni patient or napipit niya yung dull sensation dito sa sides ng paper clip na to. And next is in the sharp stimuli. So, using the sharp side, ask natin si patient. Sir, nararamdaman po. Yes. The patient also feel the sharp sensation. After testing for the light touch, pain, and temperature sensation, next is we need to test for the vibratory sensation of the patient. So, first is we need to have the substrate for the tuning fork, and next is we need to observe the vibratory sensation at the distal radius of the patient. First, tap the tuning fork on the below of our hands and put it on the distal radius of the patient. So, sir, may nararamdaman ko kaya na vibration? Assuming na meron siyang nararamdaman, it is normal. Next is in the forefinger of the patient. So, tap and sir, may nararamdaman ko yun. So, assuming may nararamdaman yung patient na vibration and it is normal. Next is in the medial malleolus of the patient. So, and it is normal. Next is in the great toe of the patient, tip of the great toe. Sir, may nararamdaman. So, this is normal. Next is to assess for the sensitivity of position. So, in doing that procedure, hold natin yung kamay ni patient and has to close his eyes. And sir, ihulaan niyo po kung, sabihin niyo po kung anong direction po, kung taas, baba, side, or side yung pag-move ng fingers niyo. Sir, ito po.
Taas. Baba. Dito. Taas.
So, as you can see, the patient is able to identify the directions kung saan natin pinupunta yung arms niya, which is normal. Dapat niyang ma-identify yung directions na yun. After performing the test for position sensation, next is proceed to the test for tactile discrimination or fine touches. So, ask natin si patient na i-close yung mata and maglagay tayo ng familiar object sa palms ng patient, sir. And pahulaan natin kung ano ito.
Kutsara.
So, the patient was able to identify what this object yung nilagay natin sa palms niya, and it is a spoon and it is normal. Next, we need to assess for the anesthesia of the patient. Magsusulat lang tayo ng imaginary number sa palms ng patient while closed eyes, and ipapahula lang natin kung anong number yung isusulat natin. So,
6.
So that's right. The patient was able to identify kung ano yung sinulat natin na imaginary number. Next is we need to assess the reflexes of the patient. So assessing the reflexes, first is we need to test the deep tendon reflex on the bicep, tricep, patellar, Achilles, and incalculus of the patient. So first, the bicep. First, we need to next is we need to test the tendon reflex on the bicep of the patient. Imagine that it is a percussion hammer. Observe lang natin. Ayan. As you can see, muscle is thin and there is a constriction which is normal. Next is in the brachiobrachialis of the patient. Ayan, makikita natin may constriction and nagmo-move siya, which is a normal. Next is on the tricep of the patient. Ayan, so makikita natin gumagalaw, so which is normal also. Next is we need to perform the Achilles tendon reflex on the Achilles. So, ayan, so ayan yung movement na nakikita, which is also normal. And so that's all for the assessment of neurologic system for this week's RLE. So thank you, sir.